The Ortho PAC podcast, hosted by Sam Dyer, Chuck Dowell, and Miles Gilbreath. Welcome to the Ortho PAC podcast, where we attempt to fill in the gaps between education, current events, and real-world practice. Welcome back, listeners. Today we have another panel discussion with Chuck and Miles, and we're talking about when can we return to sports. Let's talk some more. We talked about cortisone injections. Let's talk about how about activities like post-operative. And I don't know, Miles, if you see a lot of these. I used to see a lot of post-ops. You know, in an urgent care, if it's not busy, or if it's busy, sometimes you get add-on, pre-ops, post-ops, whatever. So let's talk about return activities, say a rotator cuff repair or a knee scope or even arthroplasties. What do you tell patients about that? You know, when you're pre-opping them, when are they going to be able to get back to stuff? Or when you see them post-op, what do you tell them?
Yeah, I mean, those surgeries you mentioned, there's obviously a wide variability because of the extensiveness of the surgery. I think it depends on the size of the rotator cuff tear and how large the repair is. Most arthroplasty surgeries is pretty uniform on when they get back to activity. Obviously, knee arthroscopies, it's a lot quicker, but as you said, I think it's about having the discussion with the patient on what their activities they're trying to get back to are. I think sometimes there's unrealistic expectations for patients. You know, they'll say, hey, I want to get back to running. And you ask them the question, well, when was the last time you did a lot of running? And they say, 5 or 8 years ago, but I've always wanted to get back to it. Discussing with the patient, hey, maybe after your arthroplasty, we shouldn't get back to those high-level pounding activities as it could cause, detrimental effects to the arthroplasty, but maybe cross-training low level activities with some occasional running. Again, it could be very individualized depending on the surgery, the extensiveness of the surgery, and the activities they want to get back to. I think it's just sitting down and having a good conversation with the patient, and just, as you said, Sam, educating the patient on what the outcomes would be if you get back too soon and what the concerns would be if you get back too soon.
That's a little bit out of my realm of standard practice. When I'm seeing post-op patients in the urgent care, they're more post-op complications that need to be seen day of. And so even when I do see those patients, if they delve into the recovery and what's to be expected, I really defer that back to their surgical team. And I've worked with various surgical teams across my practice, and even a rotator cuff, obviously there's a big degree of severity of rotator cuffs, but say something like a knee arthroscopy or subacromial decompression, things like that. I think each surgeon kind of has their own post-operative timeline, and I'm very careful, unless I'm extremely familiar with that surgeon's post-operative care, to kind of not dive into that realm.
I think here's my take. A surgeon's trying to schedule cases and trying to see 50 to 60 patients. They're not really, they tell the patients a lot of things, and how much is communicated and how much is heard by the patients. In my experience, in that 5-minute setting where you need a joint replacement, sometimes they don't hear everything. And a lot of times they don't, they need a little reinforcement. So at pre-op, that's part of the PA job. If you're doing a pre-op, is to explain some of this stuff. So it's important to know. And then post-op, everything goes out the window. First, it's pain management, then this, then that. So, what about returning after some of these things? And I'll go back. I know, Miles, you have more experience with the acute stuff than some of these follow-ups and things. But yeah, rotator cuffs, it can be months before you get back. If it's a massive retracted tear, it can be up to a year. A knee scope, depending on the level of athlete and what was done, if it's just a simple partial meniscectomy, by 6 weeks, you should be able to do a lot. If you're a professional athlete and they go back in 2 weeks, why can't I? Well, that cat's making $100 million a year to do that, and he doesn't care what's going to happen in 10 years so much. So, if it's a chondroplasty microfracture, that can take months to get back. So it just depends on what they have. The arthroplasties, I got a buddy that I saw yesterday who's less than 6 weeks out. He's walking the course, the golf course, and I'm thinking, well, that's great, but, maybe not push it too hard if you get these effusions. So those are the kinds of things to think about. But yeah, depending on what they're having done, it can take a long time.
I could share a personal anecdote. So I'm certainly no professional athlete and maybe just hard-headed, but
I can attest to both of those, but go ahead.
Yeah. So this was 2015. So a good long while ago. I was the clinical assistant, and I had a dirt bike accident right at the end of fall, and ended up hurting my ankle, which was the biggest thing. But then fast forward 3 to 4 weeks later, and I had this huge knee effusion. And so we aspirated my knee. We got an MRI. There was a big loose body in there. I've got a large OCD on my posteromedial femoral condyle, which I elected not to microfracture. Ski season was 3 weeks away. We did a loose body excision, cleaned up the meniscus a little bit, and then I was skiing again 3 weeks later. A little bit of pain, a little bit of atrophy, but felt safe and confident doing so. You know, I have that experience of seeing how quickly you can get back after a simple procedure, knowing, you know, with the knowledge I had that microfracture was going to put me out 6 to 8 weeks.
Miles, you bring up a really good point there, which I think is part of the conversation as well. Is Miles, you know, you were skiing beforehand and you were in shape and kind of a fit athlete. And I think your ability to recover after some of these surgeries is a little bit better, and you can get back a little bit quicker because you won't lose as much muscle strength. Your neuromuscular control won't be affected as much, and your muscles can kind of unload those areas and support those areas where then you can go back and do skiing activities in a quicker fashion, if that makes sense, versus some of our other patients who are arthroplasty patients who have struggled with knee arthritis and potentially struggle with activities for a longer period of time. Their ability to control that joint or their strength within that joint is a little bit less. And so maybe their recovery is going to be a little bit more prolonged. So I think as Sam and Miles mentioned, I really individualize it on each person because, you know, somebody comes in and they have a rotator cuff repair, but they're a strong person, they've been fit, they've been athletic, and they're still compensating well through it. Their recovery might be a little bit quicker because they might not have as much muscle atrophy, and their ability to kind of control that joint afterwards may come back a lot quicker. So I think that's a point as well to make.
Yeah, absolutely. All great points. I want to say something to our younger colleagues, especially. Make sure that when somebody comes back post-op, when you're talking about return to activities, that you understand what your surgeon wants to do, what their protocols are. In my practice, we have like a protocol list. You know, it tells what to do for injections for different providers. It talks about what to include on your pre-ops, and it talks about post-op, day 1, day 2, week 1, week 2, whatever. And after a while, you kind of know. But it's important to check the op note because sometimes, you know, a partial meniscectomy in activity is way different than a meniscal repair.
Mhm.
You know, if they throw some anchors or sutures or whatever, or like Miles said, you know, an Oates procedure or chondroplasty or microfracture, whatever, make sure you understand what's going on because not every knee scope will go at the same time. And the same goes with like arthroplasty. So kind of make sure you understand those post-op protocols. And I know senior guys and, you know, people that have been doing this a while understand that. For our newer colleagues, it's important to do that. It's not every situation fits the same bill. And I think that's an important thing to understand as well. Listeners, please follow up next week for a continued discussion on when can I return to sports. Listeners, I hope you can join us at one of our upcoming CME meetings. We have our musculoskeletal ultrasound workshop from February the 28th through March the 2nd in Charlotte this year. We also have our Ortho in the West annual conference, March 28th through March 30th. Look on paos.org for details.